Please check. So good evening, everybody. We are glad to be here again, getting the second installment of our Cirrhosis presentations live to you. We just wanted to continue from where we left off last week. We said that we will share some data with you, and we've been able to do that. And we are happy to, as usual, answer your questions. Please type your questions in the chat box, and we will try to answer them as and when we see them, or towards the end of the presentation, we will make sure that we answer as many questions as possible. Okay, so I'm just going to get Dr. Anita to start the presentation as soon as possible. Dr. Anita, anytime you are ready to do so, please go ahead and get started.
Yeah, can you see my presentation screen?
No, but it doesn't matter. I think I will do the needful. So can you see it? Can you see the presentation now?
No, I can't see it.
Are you able to see the presentation?
Yeah. Yes.
Go ahead. You tell me to go to the next slide, and I will do it.
All right.
Go ahead, Dr. Anita.
A very good evening to all of you. Very glad to have you back. We will be continuing from where we left off last week. Last week, we showed you how liver cure complex 4 actually helps in getting rid of the hepatitis B virus in a cell culture model. So today we're going to share with you a case study on how liver cure complex 4 cures liver cirrhosis. So before we start, I just want to say a couple of words about the liver itself. So the liver is actually the workhorse of the digestive system. This is the second largest organ in the body, and it performs more than 500 functions and ensures that our body is kept fit and safe. Now, anything that we eat or drink actually is ingested in the mouth, digested in the stomach and the intestine, and then it is taken to the liver for the first step of filtration or for removing the toxins. So when the liver decides to detoxify all the toxins in the body, it also simultaneously makes sure that all the fats are broken down and any excess carbohydrates and proteins are stored in the liver for future use whenever it may be required. So the liver pretty much takes care of the entire body. And also by removing all the toxins whenever it may be required. So the liver and whenever required, it removes all the toxins, thereby making sure the blood is free from all the toxins and all the other organs in the body are kept safe. Now, liver health is not an option; it is mandatory, and it's very, very important that the liver always functions at the optimal capacity. Unfortunately, when there is a damage to the liver, it actually takes a toll on the entire body. Now, what causes damages to the liver? It's generally the kind of abuse that the liver undergoes because of the kind of food that we eat, the environment that we are subjected to, the pollution, the toxins in the food and the environment, etc. So what happens is the first step normally, the abuse to the liver happens over a period of time. And the first step is normally fat deposits in the liver, because when the liver gets damaged, the functioning of the liver is not optimal, and therefore the fat breakdown gets impacted. That's the very first step that happens, and you find fat deposits in the liver, and this condition is known as the fatty liver. And generally what happens is when there is some kind of impact or abuse to the liver cells die, the hepatocytes in the liver die. Liver is a very, very sturdy organ most of the time, and when these hepatocytes die, the liver starts regenerating these hepatocytes. But sometimes what happens is the abuse is constant. The liver is constantly getting abused and hepatocytes keep dying. The rate at which the hepatocytes die and the rate at which the liver regenerates these hepatocytes, there is a mismatch. So more hepatocytes or more liver cells die than the cells that are being made. So there's a little gap in the number of cells, and these gaps are filled with what is known as collagen or the scar tissue. Now, the first stage of damage to the liver is called the fibrosis, where the scar tissue forms, and if the abuse continues, then most of the liver cells are dead, and a majority of the liver is filled with collagen or scar tissue, which means that the liver cannot do any function properly because the liver cells and the tissues are dead. Now, this what you see on the slide is actually a cartoon of normal liver moving on to form the fatty liver, which goes on to form liver fibrosis and the liver cirrhosis. Now, as far as allopathy is concerned, for fatty liver, you have only exercise and diet as the treatment regimen. And if you get fibrosis or cirrhosis, it is considered irreversible. And very often they recommend liver transplant. Whereas in Ayurveda, fatty liver is reversible. At fibrosis stage, it's reversible. And even at cirrhosis stage, it's reversible. So can we move on to the next slide? I just want to give you briefly what the symptoms are of various stages of liver damage. Now, generally, when you have fatty liver, there are no symptoms. Like most people don't realize they have a fatty liver unless they go and get a scan of the liver for some reason they get scanned and they realize that there is fat deposits on the liver. Rarely you find people who show fatigue or weight loss and some amount of abdominal pain. In case of fibrosis, there is definitely some kind of indication to the body. So people have to be careful and understand when the body is trying to tell them something. There is generally loss of appetite. For some people, for many people, there's actually an unexplained weakness and a constant fatigue in their body. Dr. Jammi, can you make it full screen?
It is full screen.
Okay, because there's somebody's asked for a full screen. Okay, no, so there's some unexplained weakness and fatigue. There's weight loss, nausea, vomiting. I mean, all this actually goes on to lack of appetite. And very often they have a mild pain or a discomfort in the stomach region. And fibrosis always is accompanied by jaundice because, there's an increase in bilirubin content because of poor liver function. The next stage is cirrhosis. Cirrhosis, what happens during cirrhosis is there's a lot of pain in the abdomen. There is gastrointestinal bleeding, and invariably people have dark stools because there's a lot of digested blood in the stools. Very often there is fluid accumulation in the liver. It's called ascites. There is jaundice. And of course, all the symptoms of fibrosis are present even here, like you have fatigue, feeling of weakness, loss of appetite. There's a lot of hormonal imbalance in the body because liver is actually a seat of many of these hormone manufacturing activities in the body. Most people lose weight. Some people gain weight because of a lot of fluid accumulation in the body. There is some people experience blood in urine also. That is, the broken blood cells pass out through urine. Enlarged veins around the belly button. These are all not very commonly found, but some people do show these symptoms. There's mental confusion, there's muscle weakness, shortness of breath because of accumulation of fluid in the body, and swelling of edema or swelling of extremities happen. And there are swollen veins, and especially in the lower part of the esophagus, causing esophageal varices. Can we move on to the next slide? Okay, so the laboratory parameters that are generally tested for liver cirrhosis are what we commonly call as ALT. It used to be known as SGPT. Then you have AST, which was known as SGOT. They check bilirubin. They check both total bilirubin and the direct and indirect bilirubin. GGT is checked. Alkaline phosphatase, globulin, and albumin is checked. Everything except albumin generally increases during liver cirrhosis. This is because most of these enzymes like ALT, AST, GGT are found in the liver, and they play a lot of role in breaking down of proteins and other functions in the liver. So when there is liver damage, these enzymes get leaked into the bloodstream, and therefore there is there is a higher concentration of these enzymes in the bloodstream. So these are all markers to understand if there is a liver damage. We move on to the next slide. So this is this. I'm going to give you a little bit of information about the standard treatment protocol that happens in our clinic. We have been treating liver patients for almost 100 years now, and in the 50s and 60s there were a lot of cases of liver cirrhosis in children, infantile cirrhosis, and like people in at least most people would just say that they had swollen stomach. Because they didn't know what the cause was, and all these patients, like thousands and thousands of patients, have been treated in our clinic. And so this we have a standard treatment protocol for different stages of liver cirrhosis. Now, the first stage, where you have something like the fatty liver, we normally treat the patients with liver cure complex 4, which shall be noted as CFT in all our slides, and another product called Nutritone. So liver cure complex 4 is like the first week we give 1 TID, and second week onwards we give 2 TID. This is because these patients already have some amount of liver damage, and we want some amount of equilibration of this medicine to happen in the system. So we start off with 1 TID, move on to 2 TID from the second week onwards. And Nutritone, we give 1 spoon. There's a spoon always kept inside the Nutritone. We give 1 spoon of Nutritone twice a day. And this is normally continued till the clinical parameters are normalized. Invariably, the symptoms that the patients have, like loss of appetite and weakness and all that, goes off in a month. Most cases goes off in a month's time. The next is a slightly more advanced level of cirrhosis, where you have cirrhosis with ascites or edema. In that case, along with CFT or the liver cure complex 4 and Nutritone, we also include another medicine called Redema. So CFT, again here, first week is 1 TID. From second week onwards, it's 2 TID. Redema is also 2 TID. We continue to give Nutritone 1 spoon twice a day. Now, ascites actually means that the liver is rather badly damaged. I mean, it's deteriorated. And the clinicians generally call this the decompensated cirrhosis, because these patients are considered to have gone long into the liver damage, and very often such patients are recommended for liver transplantation. So the next stage, Dr. Jammi, can you move on to the next slide? And there are a lot of patients who have esophageal varices because of liver cirrhosis. Now, esophageal varices happen because scar tissues block the portal circulatory system from supplying blood to the liver, and also from removing the deoxygenated blood from the or the bad blood from the liver. So what happens when there is this blockage is the blood starts going into all the smaller veins, because it's like a traffic block. It tries to bypass this block and get to its final destination. So in such case, what happens is the blood moves into smaller veins, and these veins are not capable of handling such high volumes of blood. And because of the volume of blood and the pressure that it causes, the veins break and it causes bleeding. This happens usually in the lower part of the esophagus. So these are called esophageal varices. So for such patients, along with CFT, Nutritone, and Redema, we give what is known as Laksha. Laksha is a capsule that we again give 2 TID. Laksha is in fact responsible for preventing internal bleeding in such patients. And one of the very, very common side effects of cirrhosis is weakness. So if people with cirrhosis show a lot of weakness, and they're not able to even function to a small extent, we give them what is known as GTP. GTP again is given 2 TID along with Nutritone and CFT. Now, if such patients have cirrhosis, ascites, and weakness, then we give them CFT, Nutritone, GTP, and Redema. And if they have esophageal varices or internal bleeding, we include Laksha with this. So, next slide, please. we had a very detailed talk on viral hepatitis last week. So if we have patients who have liver cirrhosis because of viral hepatitis, then we give them liver cure complex 4 to take care of the liver. We give them Nutritone to help in them getting back their appetite, and we give them Pyrrole, which is a antiviral. Now Pyrrole here is given 2 TID, and this will be a long-term treatment. We continue to give Pyrrole Pyrrole to these patients till their viral load becomes negative. CFT and NTG is given till all their other clinical parameters become normal. Next slide, please. Okay, so we are now going on to a case study. Now, this is a report of a male. He was 60 years old. His diagnosis was liver cirrhosis. I mean, he came back after undergoing some kind of treatment with the allopathy doctors, and they had recommended liver transplantation for him. This gentleman was not very happy about undergoing liver transplantation, and somebody recommended him to our clinic. So he came with his reports. He had mostly scan reports and, of course, the other laboratory reports of all the enzymes. But this is what the scan report said. His liver had slightly enlarged, and it had showed atrophy and hypertrophy. So there were some regions of the liver which had got badly damaged, and there were some portions of the liver which was filled with collagen, and therefore it had become bigger in size. And this kind of atrophy and hypertrophy were kind of distributed throughout his liver, and his liver showed a lot of nodules. These nodules were under the surface of the liver organ itself, and marginal irregularities were present because there were a lot of scar tissue on the liver. His spleen had also shown my slight enlargement, and there was some amount of some nodules present on the spleen also. So the scan and the conclusion by the doctors who checked his scan report was that he had cirrhosis of the liver, and he had no hypervascularity in the nodule, but he had several nodules that were present on the liver. And he showed dilated splenoportal axis, meaning like his portal vein was enlarged, probably because of clotting of blood and scar tissues in and around that area. He showed clinical symptoms like abdominal pain. He had loss of appetite. He showed severe weakness. He had fatigue, and he also had severe case of constipation. So in the clinic, our doctor recommended CFT, which was initially 1 TID, and then from second week onwards 2 TID, because he was showing enlargement of the portal vein. We also gave him Laksha 2 TID. Because of his constipation, he was given Tripcaps 1 TID, and Nutritone was BD. Next slide, please. So he went through. He came to us on 5th of July 2017, and when he came to us, all his parameters were elevated. You'll find all the elevated parameters are marked blue in the slide. I mean, his total bilirubin, direct, indirect, SGOT, SGPT, GGT, ALP, and were all increased. His total protein was also slightly higher, and his albumin globulin were okay. I mean, were high, but not very, very high. And he was asked to take the medicines that I just mentioned, the CFT, Nutritone, Laksha, and Tripcaps for about 5 months, and come back to us. When he came, with a whole set of test reports. So when he came back to us after 5 months, his bilirubin levels had come to normal. So was his direct and indirect bilirubin. His SGOT had reduced, had come down by almost 1/3, and SGPT had come down by almost 1/5. But they were still a little higher than the reference values that are given for normal patients. His GGT, ALP, total protein, albumin, and globulin had all come to normal levels. And we asked him to continue his medication for another 6 months. And when he came back to us after 6 months, all his parameters had normalized, and they were in the level of the normal patient liver conditions. We, however, requested him to continue his medication for some more, for couple of years more. And the latest report that he gave us was actually on 28/9/2020, and he's doing perfectly all right now. He's still on medications for the same medications with slight modification in the dosage. He still continues to have these medications. His the symptoms that he had, like fatigue, pain in the stomach, and weakness, and all that, reduced by the time he came to us for the second set of consultations. Now, this is just a graphical representation of all the parameters that we just saw in the previous table. This is just to show you how well he reacted to the medicines. If you see, AST came down drastically, like came down by 1/3 by the end of 6 months, and by the time he came to us for the second set of results by end of the year, all his parameters were normal. I mean, even his AST and ALT, which were the only two parameters that were still high after 6 months, had also come down. Now, you must remember that this was a patient who was recommended liver transplant, because they said there was no other way his liver functions could be normalized. Can you move to the next slide? This is again the total bilirubin, which became normal in the very first, in the first 6 months itself. So had alkaline phosphatase. The lower set of readings actually show you direct and indirect bilirubin, which also normalized. His proteins, protein albumin and total protein albumin and globulin were not a very serious problem right from the beginning. So they just continued to normalize and came to the normal level. Move to the next slide. So this is the summary of his case study. Now, he came to us on 5th of July 2017. And like I mentioned earlier, his scan report said he was a clear case of cirrhosis of the liver, and he had mildly enlarged spleen. His portal veins had enlarged, and he came with symptoms of poor appetite, weakness, fatigue, and constipation. At the end of 6 months, his liver from cirrhosis became just a mildly enlarged liver, and it showed altered parenchymal echoes. I mean, it was almost like the conditions that you would see in case of fatty liver. His spleen was still mildly enlarged, but it showed normal texture, and there were no lesions seen on his liver. And as far as his general symptoms were concerned, he had overall improved a lot. However, he said his constipation continued, so we increased his trip cap dose from 1 BD to 1 TID to 2 TID. So when he came to us on 25th of March 2019, his scan report said liver is normal and shows no nodules or lesions or any abnormality. Meaning, look, it appeared that the scar tissues had completely healed and he had a normal functioning liver. Now, this happened in about, of course, this was when he took the scan. So it's possible that it happened much earlier. But if you see the general time period, it took about 18 months from the scan report. If you see, it took 18 months for him to completely recover. Whereas his parameters, his liver parameters, liver functioning started becoming almost normal by the end of 6 months, and by the end of 1 year, his liver enzymes were all absolutely normal. Can we go on to the next slide? Yeah. So this is as far as the case study is concerned. So if you have any questions.
So if you have any questions, we're happy to answer this. Please type your questions and we will be happy to answer your questions. So I don't see any questions. So we will wait for some more time. We will wait for another 5, maybe 2 to 3 minutes. And then if not, we can quickly summarize and then we can finish today's presentation.
Yeah, Dr. Jammi, we have some several questions right now, and I thanks to all the
Actually,
doctors.
I can't see anything. This is all I
Yeah,
saw.
let me just start. Let me just start with so as far as the milk products are concerned, how it is related to the ascites, and one doctor is asking. So maybe you can just throw some light on that, and accordingly we can take it forward. And there are some
Yeah.
questions on our message box. We will try to post here on the screen also.
So typically, what we tell people is, as far as diet is concerned, we tell to go easy on the fatty food. Be very careful about the intake of fat. Again, milk. It cannot be buffalo milk. It cannot be packet milk. That is, the dairy milk. It has to be A2 milk from cows, which is very light and which is helpful for increasing the digestion. But otherwise, we don't recommend any of these pasteurized packet milks. These are all things that it's a big no-no. And we ask them to go easy on tamarind. We also tell them to go easy on bananas. Okay, so bananas are a complete no-no as far as the cirrhosis is concerned, simply because bananas are known to increase the pitta dosha in the body, and cirrhosis, obviously being a disease of the liver, is a pitta related disease, and we tell people that they have to avoid bananas completely. So somebody said, please let us know the duration for cirrhosis patients. This particular case study showed a complete recovery in 18 months. There are people who have been treated for nearly 2 years, 2.5 years, also depending upon the severity of the disease. So it is entirely case to case dependent. It's not one size fits all. So we'll just have to be patient. And please remember, this cirrhotic liver has happened because of years and years of abuse, right? It doesn't happen overnight. They're probably doing the livers over 20 years, 25 years. So it is not something that you can expect a cure for overnight, unless, of course, you're going for a liver transplantation, in which case the longevity of the patient is completely reduced. There is very poor chance of recovery as far as the transplantation is concerned. So what we have seen, and what we've seen extensively, is that they start able to live a normal life within, say, about 1 year of taking the medicine, 6 months to 1 year of taking the medicines. But then for them to all the clinical parameters, all the scan reports, everything to become normal, anywhere from it can take anywhere from, say, 2 years, or in this case 18 months to 3 years. That's typically the average time based on the severity of the disease. Total monthly cost for the treatment, depending upon the various the situation it comes from, it can cost anywhere from 1,500 to 2,500 rupees, depending upon what. Suppose he's got esophageal varices, and then it'll take probably a little bit more, maybe 3,000 rupees or 3,500 rupees. But it does not cost anything more than 4,000 rupees a month. Uh, Given, let's assume he's got all the possible symptoms that you could have, all the complications of a cirrhotic liver, ascites, esophageal varices, constipation, obviously lack of appetite, mental confusion. Because you put everything together, it won't cost anything more than 4,000 rupees. So if you do the math, so that's 48,000 rupees a year into, let's say, 3 years. That's about 1.5 lakhs, as opposed to a transplant that will cost anywhere from 30 to 50 lakhs. So it's pretty straightforward, no-brainer as far as what the course of action should be. How can you get connected with us, sir? Our website is www.jammi.in, and the contact numbers are there. You can feel free to reach us, and we will make sure that one of our people get back to you. How can we get the medicines for our clinic, sir? We can Please send us your contact information. We will have our people reach out to you, and we can ship it out to you. As a matter of fact, after last week's talk, one of the doctors from Nainital had contacted us, and we had already shipped out the medicines to them in a matter of 3 days to 4 days. So please reach out to us, and we'll be happy to reach out to you anywhere in the Indian subcontinent. No problem. How many cirrhosis cases healed till now? My God, I think I can't. So if you had looked at the Indian childhood cirrhosis, which is what was rampant, it was endemic to the Indian subcontinent in the early 20s and 30s. Literally tens of lakhs of children were cured. Remember, please remember this. All of these medicines were made and formulated to treat bala rogas, which is what our great grandfather was an expert in. So it's just that for the adults the dosage has been increased. So that's the only difference between the formulations for children as opposed to adults. So I would say lakhs and lakhs of patients have been treated over the last 100 years, but over the last say 15 years, 10, 15 years, we would say people have been caught up with this whole transplantation thing. But whoever have given up, or whoever didn't have the money and who come to us, we've pretty much cured them at a 98 to 99% success rate. And when they do come to us at the very end stage where they have a couple of months to live, in that case we tell them that we can't guarantee any success, but we do tell them very clearly that they can try it if they want, or we just tell them very frankly that they've come to us way too late. They've come at stage 4 of the cirrhosis liver, which is at that point in time it can be very, very difficult to cure. Clarified difference in dose for kids and adults, depending upon again the severity. It's typically 1/4 to half the dosage of the adults that is there for the kids. Complications can be managed conservatively, very much so. We don't really have to. As you start taking these medicines, and over time you start noticing that the complications come down, right? So it is very conservative. We don't. The worst that we've seen as far as the immediate requirement of relief was in terms of removal of the abdominal fluid, ascitic fluid, and that was done for just 1 or 2 cases. But otherwise, it happens conservatively and happens by itself. How much time will be for your delivery of these medicines? It can take anywhere from 5 to 7 days, depending upon where you are in the country. Yeah, lately, ever since COVID has happened, we are looking at patients online. We are looking for their blood reports and their scan reports and everything. But there is nothing like actually coming to our patients and having my father palpate the livers, and which is something that happens over years and years and years of experience. So we've started doing online simply because that's the need of the hour, and we ask for an extensive, complete blood workup and scan report before we start the treatment. Otherwise, we don't treat them. We need all the reports, and we need reports to happen once in 3 months as far as the blood work and the scans are concerned. So yeah, we can give it in Hyderabad also. Hyderabad, we already have medicines over there. What do you mean by prognosis uncertain? I didn't understand that. What you mean by prognosis uncertain? As far as our medicines are concerned, our prognosis has been that we are able to cure them completely in more than 99% of the cases. It's 0.5 to 0.7% where they come too late, in which we tell them that it's going to be difficult. What will be the next week topic? We will again do one more a session on the liver, and we will wrap up the liver related topics by next week. So, any other questions? In which outlet your medicines deliver in Hyderabad? I think Mr. Madhusudan will be able to answer that question. And unfortunately, he's gone through an oral surgery right now, so maybe he will probably send you a message. I have your contact details, Dr. Rizvi, and we'll make sure that we get in touch with you in Hyderabad. Yeah, he will do it.
Yeah, thank you so much. I think we already addressed all the questions, and thank you again for an exciting session. And definitely, liver cirrhosis is a very complicated disease with so much of ease and simplicity you people are managing. So, hats off to you. And uh, you correctly mentioned that the entire cost is of transplant is starting from 25-30 lakh to it can go to 40-50 lakh, which we if we can save that in few maybe couple of lakhs, that is remarkable. And that also it's like an EMI. So we are just investing
Yeah,
4,000,
yeah.
5,000 rupees a month. So just on the lighter note, I know the severity and we are dealing with a few cases. And we have in fact started your medicines, that is liver cure. I ordered that, and we are getting very good response along with the Pyral DS. So thank you so much. And in fact, today also I placed my second order for liver cure, and we are getting very good response from liver cure. The initial responses are very good. So I personally request all the doctors who are listening to this, do order medicines from Jammi Pharma. They are very good in quality, no doubt. They have maintained that from last so many years, and personally we are using in our clinic and we are seeing the response. So next week we will again have a session on liver, so that you all can discuss your queries and questions
Yeah, Dr.
regarding
Junaid,
that.
like I said, next week will just be questions. So we won't
Right.
have any presentations per se. It'll be questions from all doctors, various. We can talk to them about protocols, the different regimens, any doubts in terms of the medication. So anything,
So
it's
what we
question.
will
It's
do
going to
is,
be a question.
yeah. So what we
Yeah.
will do is, we will run an internal set of internal set of campaign from tomorrow onwards. We will run on our platform and on our various groups, and we will request all the doctors to submit questions, so that we will have a group of questions with us, which we can discuss in the next session. So I request all the doctors who are listening to us, please do watch our Facebook page, and we will have a form in which you can submit your questions, and we will compile all the questions and we will discuss with the Jammi Pharma team next week. The final question for the day we can have is regarding the prognosis. So I think the doctor want to ask is the criteria, or maybe the maybe the progression, or maybe your experience with the prognosis you have seen. So maybe you can just clarify on that aspect.
Actually, I still didn't understand the question. I don't quite understand what you mean by prognosis criteria.
I
Is
think
Can you?
they want to understand that, like for example, we have seen, like for with your treatment or with your experience, the survival, the quality of life,
Okay.
how many patients are able to survive or maybe heal, because generally in these kind of cases the prognosis is like, he or she can live for few months or few years. So maybe
Okay.
on that you can clarify.
Dr. Sudhanshu, so I understand the question now. Thank you, Dr. Piyush, for clarifying that. What we've seen is that typically we've seen that the quality of life improves within, say, about 3 months, right? So they start feeling better, they're able to eat better, and as that happens, they also start getting stronger. And in about 6 months to 8 months, their parameters also, clinical parameters also start getting better. And I think by about a year and a half, they start getting completely recovered from their problems. And cirrhosis has been something that has been our staple disease. Everybody comes to our lab to our clinic at the very end, when all the doctors have given up and when they've all said you need to get a transplantation done. So you can understand that that's at the pretty much at the very last stage, stage 2 or stage 3 of cirrhosis. So from that point, I would say you would say you'll need 6 months where they can start feeling a lot better. I'm being very conservative. I think it's better to be conservative than being too liberal and giving false hope to patients. You be very conservative with them. Tell them 6 weeks. It'll take at least 6 months to start seeing an effect in terms of your quality of life. But for them to be completely cured, we are very clear, very categorical, saying for them to be completely cured, where they can go back to leading their normal lives, is 3 years. So that is a standard thing. We don't give them false hopes. We don't give them any such. This is not a magic bullet. This is your, like I keep telling everybody. You've ruined your liver over 25 years. Please understand that you have to be patient with it, and it's going to take some time to get back. But like I said, you will start seeing an improvement in the quality of your life very soon. Within 3 to 6 months, you start noticing an increase in your appetite, regaining your strength, and all of those kinds of things. Please remember, no alcohol, no smoking. Non-veg is you need, because there's too much of fat in it. You need to completely control your non-vegetarian habits. So we can talk more about the diet next week, because all of these things are very important. Please understand that your liver is going to metabolize and uh, you know uh, detoxify your entire system, and that needs to be working in full throttle, which means you need to help it as much you possibly can by taking the right kind of food inside. Okay, I think we're. Um, I think we're all set. Thank you very much for attending the presentation. We look forward to your questions and queries, and any questions that you have about the liver, we will try to answer. We have gained extensive experience over the last 123 years, so we will try to share it with you as best as we possibly can. And we hope that you're able to cure as many patients as we have all across the country, because liver disease is a very, very serious disease that needs to be addressed, and people don't have to get rid of their life savings or their house, mortgage their house in order to be able to cure it. It can be done at a very meager cost. सर मैंने आपकी सारी मेडिसिन ऑर्डर की है लिवर प्रॉब्लम में, और भी मेडिसिन देनी है या फिर आपकी मेडिसिन काफ़ी है सर? डॉक्टर आनंद, आई थिंक आर द एंटायर presentation what we have given you for the various symptoms, those medicines are more than sufficient to address the various complications of the cirrhosis problems the patient has. So we will be happy to talk to you one-on-one and understand better the case history of the patient, and we'll be able to tell you and work with you on understanding how and what more information you need. So, but as far as the cirrhosis is concerned, the entire treatment regimen has been presented to you. You don't need to add anything else to it other than these. Okay, so I think we are ready to call it a night. So thank you all very much, and we look forward to hearing from you with your questions next week. Thank you.
Yeah. Thank you. Thank you all very much. Thank you.
Good night.